The first reports came quietly, patients arriving at a hospital in Hanoi with fevers that wouldn't break, coughs that deepened into gasps for air, lungs filling as if drowning from the inside. Doctors suspected pneumonia, but this was different. The disease spread like wildfire, overwhelming wards in days. And at the center of it all stood Dr. Carlo Urbani, an Italian physician working for the World Health Organization. He had treated the poor in Cambodia, fought parasitic diseases in Laos, and earned respect for going where others would not. But nothing prepared him for what he faced in February 2003. A patient arrived at the French hospital in Hanoi, a businessman, gravely ill after a flight from Hong Kong. His condition baffled the staff. Fever, respiratory distress, unresponsive to normal treatment. Urbani, called to examine him, quickly realized this was no ordinary illness. "This is something new," he told the staff, "and it's dangerous. And it's dangerous." He could have left. He could have withdrawn to the safety of an office, issuing reports from afar. But Urbani believed a doctor's place was with the sick. He walked the wards daily, mask on, clipboard in hand, carefully documenting symptoms, tracing contacts, urging strict quarantine. He pressed the government to act swiftly, to contain what he already knew could spread across borders like a storm. But as he fought for containment, the disease began claiming those around him. Nurses, orderlies, even young doctors. Colleagues fell ill, one by one, their coughs echoing through the hospital corridors. Fear gripped the city. Some hospitals turned patients away. Some families abandoned their sick. Yet Urbani refused to leave. He called the WHO headquarters, his voice tight with urgency. "We are dealing with a new, highly contagious disease. The world must be warned." His alarm set in motion the first global response to what would later be called SARS severe, acute respiratory syndrome. But even as the world prepared, Urbani knew he had likely been exposed. He felt it first as a fever, creeping in late at night. Then the cough, deep and relentless. He recognized the signs with grim clarity. He had become the patient. His colleagues begged him to return home, to seek treatment in Italy. He agreed, not for himself, but to prevent further spread in Hanoi. On the flight, fever burning, he wrote notes for colleagues, urging them to keep fighting, to protect the nurses, to keep strict quarantines. When the plane landed in Bangkok, he was rushed to an isolation ward. There, in a small hospital room, he continued working even from his bed. He sent updates to the WHO, describing his own symptoms in clinical detail, helping others understand the disease through the progression in his own body. Days turned into weeks. His condition worsened. His lungs weakened until each breath was a battle. Yet he never stopped thinking of the patients he had left behind. "Take care of the staff," he urged in one of his final messages. "Protect them. They are the front line." On March 29, 2003, Carlo Urbani lost his fight. He was 46 years old. The world lost not just a doctor, but a man who chose to stay among the dying when he could have walked away. But because of his sacrifice, the world was warned. Airports began screening passengers. Hospitals established isolation protocols. Governments recognized the danger and acted. His early alarm gave humanity a fighting chance against a disease that might have spread unchecked. Colleagues later said his courage saved millions. The WHO declared that his swift action had prevented SARS from becoming a global catastrophe. His name is now remembered not just in scientific journals, but in the lives of those who never knew him, yet survived because of him. Carlo Urbani left behind a wife and 3 children. His family grieved, not only a husband and father, but a man who lived by one unshakable belief: that a doctor's duty was not to comfort the safe, but to stand with the vulnerable, no matter the risk.